Hi there, my name is Rosbel Hans Estabelio from BS Psych 4B. According to the Merriam-Webster Dictionary, abortion refers to the termination or ending of a pregnancy by removing or expelling the embryo or fetus from the uterus before it can survive outside of the womb.
Hi everyone, my name is Sav. In some countries, abortion is illegal, and when a person gets pregnant, they are presented with 3 options. 1. Parenting, giving birth and raising the child. 2. Adoption, giving birth and placing your child with another person or family permanently. And 3. Terminate the pregnancy by having an abortion. From a medical perspective, abortion is a medical procedure that terminates a pregnancy. According to the World Health Organization, abortion is a common health intervention. It is safe when carried out using a method recommended by WHO, appropriate to the pregnant situation, and by someone with the necessary skills, such as doctors and the midwives.
In the Philippines, abortion has been taboo for over 100 years. There are no exceptions to the criminal laws outlawing abortion, not even the ones that permit it when a pregnant woman's life or health is in danger. Under Spanish colonial control, abortion was made illegal by the Penal Code of 1870. The criminal prohibitions were then included into the 1930 Revised Penal Code, which was passed while the United States was occupying the country of the Philippines. Abortion is generally illegal in the Philippines with very limited exceptions. The country has restrictive laws regarding abortion, and individuals who undergo the procedure may face legal consequences. According to the Revised Penal Code, doctors and midwives who conduct abortions in the Philippines with a pregnant woman's agreement might spend up to 6 years in prison. These criminal penalties are complemented by other laws such as the Medical Act, the Midwifery Act, and the Pharmaceutical Act, which set forth penalties for a variety of health workers and medical professionals, including doctors, midwives, and pharmacists who perform abortions or dispense abortifacients. If these practitioners are found to be engaged in actions related to abortion, their license to practice may be suspended or revoked by authorities. However, abortion activism in the Philippines has gotten a boost and reached a historic milestone with the explicit endorsement of the Philippine Commission on Human Rights, PCHR, for the decriminalization of abortion for the first time. As part of its priority human rights legislative agenda for the Philippines' 19th Congress, the PCHR issued the suggestion in November the 19th. Congress will end in June 2025, having convened in July 2022.
Social or public views on abortion in general can vary. While there are individuals and groups advocating for reproductive rights and more liberal abortion laws, there are also those who strongly oppose any form of legalization. These opposing sides are referred to as pro-choice and pro-life. Pro-choice advocates emphasize a woman's right to make decisions about her own body. They argue for the importance of individual autonomy and the right to choose whether or not to continue a pregnancy. The supporters often frame the issue as a matter of reproductive rights and women's access to safe and legal abortion services. They may advocate for comprehensive sex education, access to contraception, and healthcare services. On the other hand, pro-life advocates focus on the rights of the unborn fetus, considering it a human life with moral and ethical value. They argue that the right to life should take precedence over a woman's right to choose. Pro-life perspectives often emphasize promoting alternatives to abortion, such as adoption, and providing support for pregnant individuals to carry the pregnancy to term. When it comes to talking about abortion, there are different opinions. Some people believe it should be allowed and accessible. especially in situations where there are health problems during pregnancy or serious issues with the baby. They argue that if it's illegal, people might end up doing unsafe things to get an abortion. On the other side, there are those who think it's not right or it's morally wrong and it goes against their beliefs, particularly from a religious perspective. When talking about this, it's crucial to be fair and open-minded. Everyone has their own thoughts, and that's absolutely fine. But for me, well, I believe that every person should be able to decide what's best for themselves, their family, and their future. The most critical aspect is that the person who is pregnant should get to decide what is best for them. Their decision depends on their own circumstances and what they feel is the right choice. Abortion is a complicated topic, and it's very important to be understanding and respectful of different opinions while talking about it.
Pursuit. The benefits outweigh the potential negatives. An example would be when a woman is going to die during childbirth unless she undergoes abortion. I would encourage the use of abortion in that case. Another one would be when the child in the womb is identified as having a life-crippling disease. Continuing the ban is just plain stupidity in my opinion, since this would increase the chances of women resorting to other methods which may lead to their deaths. As a nation who tries to attract more tourists, it would be detrimental for the image of the country if we continue this illogical approach, since the international community would view us as backwards in terms of policy. It should also be stated that practices such as these are, in my opinion, outdated and barbaric. There have been plenty of times in history where the church did something as a practice and then got rid of them afterwards. An example of this would be the Crusades and Inquisitors of the past, where the church used violence and then did not do so anymore after centuries. Abortion, in my opinion, is the same, in the sense that I think it is a necessity in this day and age.